In 2020, an estimated 604,000 women were diagnosed with cervical cancer worldwide, with about 342,000 dying of the disease. Highly incident and high mortality rate of the cancer occurred merely 90% the time in low and middle income countries. With January being the Cervical Cancer Awareness Month, Zoe Anita Odair explores the procedure in the following feature.
The main cause of cervical cancer is persistent infection with high-risk types of human papillomavirus, HPV, an extremely common family of viruses that are transmitted through sexual contact. Vaccines exist that protect against high-risk HPV types, and screening programs can detect signs of the disease at an early stage, allowing for effective treatment and management of the condition. This means cervical cancer should be one of the most preventable forms of cancer. It starts when there is an abnormal growth of the cells in the cervix, which is the upper part of the uterus. In Ghana, cervical cancer is the leading cause of cancer deaths among women. Hence, early detection and screening is critical in the fighting against the cancer in the country. So today I'm at Marie Stopes Kokomlemle Center to have my cervix screened, and with all the options available, I opted for the visual inspection with acetic acid. I'm told through the screening I'm going to have my results in 1 minute. I'm just hoping and praying the result will turn out negative and it won't be as painful as people perceive it to be. Marie Stopes Ghana in Kokomlemle, Accra is a leading network of caring professionals delivering sexual reproductive health services. The pap smear and the visual inspection with acetic acid are the two most common procedures for cervical cancer screening.
When you have sex and then your husband or your fiancé uses his penis to be knocking very hard, that I want you to feel it at my chest or wherever you people call it to be, then this is the harm you are causing to the mouth of the baby.
As preparation for the visual inspection with acetic acid, I am given a pain reliever before the procedure began to contain the severity of any pain I am likely to endure. I am then made to lie on my back with my forelegs raised and my thighs spread wide apart. A speculum is used to open the vagina for easy access to the cervix. First, medical cotton wool wet with water is used to clean the surface of the cervix. Next, the acetic acid is applied. The patient waits for some time for the examiner to check for the results. So after a minute, I'm done with the test and the result came out negative. It was quite uncomfortable, but all the same, I'm happy I went through the process. Elom Ahadome is the clinical quality advisor and service provider at Marie Stopes Ghana. She explains apathy and fear prevents many women from seeking medical attention.
Cervical cancer includes you lying down for a service provider to look into your to look at your private part in quotes. Most people do not really want to do that. They don't want you to see there.
She also pinpoints risk factors of cervical cancer and goes on to advise on preventive measures.
Early initiation of sexual activity. We also have something about multiple sexual partners. So if you have multiple sexual partners, you are predisposed to getting cervical cancer. If you have STIs that does not heal, you treat, it doesn't go. It's one of the risk factors. Smoking in women, smoking of cigarettes in women is a predisposing factor.
The World Health Organization predicts figures of the condition may increase to 5,000 annual diagnoses and 3,300 deaths by 2025. That is just 3 years away. So, if you know your status, early treatment is a lifesaver. Get screened, get tested, and be sure you do not join the statistics. Zoe Anita Odair, Metro News, Kokomlemle, Accra.